Should the ill and elderly be put at the bottom of the list for the best organ transplants? That soon may happen under a proposed change in regulations with the organ sharing network in the United States.
Joining us live to discuss the issue, the president of the Living Bank, Carol Keeney Harrington, and the director of the Methodist Hospital Transplant Center, Dr. Osama Gaber. And I'd like to start with you, Carol Keeney Harrington. Is this a good idea?
It's going to be a controversial idea. I think it already is. I did a poll of my board last night, and it's about split in the board that it's a good idea because of the demand for kidneys. It's so huge, and they want to get the best benefit. I think that's the reason for the change or the proposal. Because the kidney is in such demand with I think there are 93,000 people on the list now out of the 110 that need an organ. So it's a huge demand because of the obesity problem, and which leads to diabetes and the high blood pressure, which does kidney damage. So it's a huge problem, and there's no way that the cadaver kidneys are ever going to solve the problem.
Dr. Gaber, what about people who've been on a list for years and then they get bumped for a younger person who's been newly added to the list? Doesn't seem quite fair.
So it seems like that, but the issue is that the majority of the organ donors now, at least a bigger proportion of them, is becoming the older recipients. So even though on the surface of it, this may seem like you're bypassing somebody, the fact of the matter is the second donor that comes on who is older, the older recipient would get priority and the younger person would be bumped. So the idea is to try to match the donor age and the recipient age so that the lifespan of the kidney matches the lifespan of the patient, instead of giving older patients kidneys that have a 25-year lifespan in which we lose enough of those years if the recipient dies. Trying to match that.
Doesn't this open the door, though, to all kinds of criteria? I mean, this older person has a much greater contribution to make to society. A huge.
That's never been an issue in transplantation.
Yeah, but doesn't this open the door to it? That's the point.
I don't think so, because the system has already. In the lung transplants, and the heart transplants, and the liver transplants, we assign livers not and on organs not based on who's waited the longer, but who is in the most need.
Carol, should there be other considerations besides age? Perhaps an older single woman or man with kids? Do they look at those types of criteria?
No, they don't look at that. There are a number of criteria, and one of them is location, because the kidney can't be outside the body. And, of course, they have to do all kinds of complex medical. I just wanted to make a point that there's no way the cadaver kidneys are going to ever cover this problem, and the best way to increase the number of kidneys that are available, of course, are living donors, and that's one of the things the Living Bank is doing now. They're working with Methodist and Memorial Hermann to screen people who want to be living donors, and the surgery is a lot safer than it used to be. And so we talk to people to make sure that's what they want to do. So I think there were about 26,000 kidney transplants last year. So, and some of those were living donors. I think it's up to about 30% now, isn't it, Dr. Gaber?
Well, thank you both for talking with us. We appreciate the time. That's the president of the Living Bank, Carol Keeney Harrington, and director of the Methodist Hospital Transplant Center, Dr. Osama Gaber.